Hello, welcome to my frequently asked questions. Today I'm looking at a slightly different topic, which is disastrous outcomes in cosmetic surgery. How do we avoid these disastrous outcomes? So, in answering this question, well, we really need to look at why is this going on? And almost every week I see articles about unfortunate patients who've had really poor or disastrous outcomes in cosmetic surgery. And the question is, well, why does this happen? What can we do to avoid these outcomes? What is going on? So, in terms of disastrous outcomes, well, what are we talking about? Well, this is one example taken from the media. Fit, healthy 57-year-old lady who went into shock after a dental procedure in Poland. And she traveled from Leeds to Poland, had a procedure on a general anesthetic, and was in a coma as a result of this. Another patient had significant organ damage after having cosmetic surgery, damage to her liver. She collapsed, had to call an ambulance, and this patient had a procedure in Australia. Why has this happened? Another patient, 22-year-old lady who was looking to have her eyes open up with blepharoplasty, had surgery under general anesthetic in India, and unfortunately she died. And it's a terrible and disastrous outcome. This patient had an unsatisfactory outcome. She traveled from London to Turkey. She had a very unhappy experience that she talked about in the media. And this also resulted from poor communication. None of the team that she was treated with spoke English, which led to communication issues. And she had a very poor experience. This patient unfortunately had a Fox eye procedure, and this was recently on British morning television. He had a terrible outcome with all this tethering around his eyelid. He saw this procedure on social media, thought it was a good idea to have it, and had this as a result. Highly unsatisfactory complication, and he had surgery in the UK. And of course, unnatural results. Some, particularly this is highlighted by celebrities, and this is an image of like Nicole Kidman, and she's got a puffy appearance, and this is really from excessive non-surgical treatments and fillers that just look puffy, and it just doesn't look natural. And we have all these kind of characteristic signs: sunset eyes, chipmunk cheeks, duck lips. This kind of unnatural appearance was resulting from cosmetic procedures. Why is this happening? This is an image of Renée Zellweger. A few years ago, she had a procedure around her eyelids that really changed her appearance. It made her look different. And there's a significant amount of artistry around facial procedures, which really needs to respect individuals' characteristics to look natural. And then, of course, there are unhappy patients who didn't get perhaps like a disaster, but they didn't get the result they were looking for. They wrote online about their experience, but they're really not happy. Their expectations weren't reached. So why do these things happen? And let's talk through them. And we're going to do that. First of all, what is our goal? Our goal is successful, happy outcomes from cosmetic procedures where you've achieved your outcomes, and avoid these kind of very serious and disastrous outcomes. And what I'm going to do is talk about these disasters. What are the actual risks in these cosmetic surgery procedures, and how can we really reduce those risks to make them very negligible? And I'm talking about these very serious outcomes. Serious complications, how do we avoid the very serious complications? Unnatural results, how do you get natural looking results where you look the best version of yourself? Unsatisfactory outcomes, well, how can we avoid these? And my personal tips. My name is Dr. Julian Silva, and I've been practicing facial, cosmetic, and plastic surgery for over 10 years, and this is my area of expertise. And I'm going to talk to you today based on education and information purposes, and of course this cannot constitute a personal consultation. So first of all, that first case that I presented to you, and of course this is a disastrous outcome, a person in a coma after a dental procedure under general anesthetic. She traveled to Poland, and quite a few of these examples that I've talked to you about, well, patients have traveled overseas. So traveling overseas to have a medical procedure or cosmetic procedure is called hospital tourism. Now, why do people do this? Well, of course, traveling to Eastern Europe, traveling to Asia or the Caribbean, well, it's lower cost. And sometimes the clinic itself can be in a posh hotel or it can be in central London, but the procedure is not. The procedure is overseas in a much cheaper environment. But often you can think, well, am I going to be on holiday? It could be somewhere nice. Well, the reality is traveling overseas to Eastern Europe or other countries, there's unknown regulation. You don't know what the safety is. There's no follow-up. Like once you've had your procedure and you travel back to the UK, there's no follow-up. And many patients do need some kind of follow-up, whether it's supportive care to aid recovery, measures to reduce swelling. But we're also looking at like really serious outcomes. There's no way of actually like of following up on your procedure. Often you meet the surgeon on the day, and you may meet a completely different person in the posh hotel in London, but then you meet a different person, and it's a one-off. Like if you want to track down that doctor, that surgeon, it can be very difficult to do that when they're overseas. Now, clearly, this is really quite high risk in terms of regulation, in terms of the person doing the procedure. You really don't know what you're getting. How does that compare with the UK? Well, the UK, well, safety is really the pinnacle of what the UK offers in terms of healthcare. And there's a lot of regulation, there's a lot of red tape, there's organizations that are set up purely to ensure patient safety. And just to give you one example, in my clinic in central London, there's regulation even on the sinks. Every single sink has no water overflow. And the reason is that water overflow that may protect from overflowing tap water is deemed an infection risk. So there's regulation around everything, how things are built and constructed and how things are maintained in terms of sterilization and autoclaving and disinfection. And that is purely designed to protect patients. Follow-up. Well, in the UK, you can absolutely find out who did the surgery, and you can go back to them and you can speak with them. You can always find your doctor, your surgeon. And of course, this is reflected in the cost. The regulation, the intricacy of how things are set up and maintained in terms of due diligence and meticulous cleaning and sterilization. This is reflected in a higher cost in cities such as London, and it's reflected off that. But when you consider the relative risks of going overseas and the unknown chance that you're taking, you have to wonder, is it really worth taking those chances? So another number of the disasters that I mentioned to you, well, these were procedures that were done under general anesthetic, where sometimes you can have very serious reactions to general anesthetic. Now, general anesthetic is often the only choice. It's what is being offered for cosmetic surgical procedures historically. From an anesthetic point of view, it's relatively straightforward to give patients general anesthetic. However, there can be rare but very serious side effects from general anesthetic. Clots in the leg, like known as DVTs. Well, DVT happens under general anesthetic because you can have pooling of blood in your legs. And although with good quality healthcare there are techniques and machines and devices that can help reduce that, there's no way of absolutely preventing it. And particularly certain age groups, younger women who are taking the oral contraceptive pill, well, that is a risk for like having a DVT, and having it under general anesthetic it's going to be a very rare but very serious complication. Serious allergies to reactions to anesthetic drugs, well, those can happen with general anesthetic. And of course, with hospital tourism, you also don't know what the regulation is. You don't know what is governing that general anesthetic procedure. So there's a relatively high risk. My personal preference is for many, particularly facial cosmetic procedures, you don't really need to have general anesthetic. You can have sedation anesthesia. And the difference with sedation anesthesia is that you're just sleeping during the surgery. You're breathing yourself. All your natural protective reflexes are working normally. You don't expect to get like a DVT, a clot when you sleep at night. And similarly with sedation anesthesia, those reflexes are helping protect you and avoid those kind of issues. You tend to have less nausea and sickness with recovery. You tend to recover much faster. Like you can, after like a procedure under sedation anesthesia, well, often your recovery is half an hour and you can go home in less than an hour after the procedure. The challenges with sedation anesthesia are, well, it's much less available. Less doctors and surgeons are going to offer you sedation because for anaesthetists, it's a very skilled area. The anaesthetist needs to be very skilled in providing patients with sedation because every patient requires different amounts of medicine. Like one person may require a tiny amount of medicine and another patient may require a bucket load of medicine. And so the anaesthetist needs to be skilled in giving you that medicine to give the best results. And of course, there's different types of sedation, and sedation can be very simplistic. And sometimes in a hospital where you have a small procedure like endoscopy, well, you could just be given one type of medicine, and that one medicine is very light sedation, and that might not be a good experience. When we give patients sedation, we give a sophisticated 4, 5 very small, modest amounts of medicine, but collectively they're very effective, which means you sleep during the procedure, but you recover very quickly afterwards. Well, how about unnatural results? Unnatural puffiness and not looking quite like you. Of course, those are not the most serious issues with non-surgical treatments. Unfortunately, non-surgical treatments can also result in permanent scarring, blindness, damage to vision, and of course those are outcomes we absolutely want to avoid at all costs. But unsatisfactory appearance and unnatural results are also things we want to avoid. How do we do that? Well, you need to do your research. Do not be too guided by social media. And social media, perfect photographs, perfect images, well, you need to do more thorough research on the doctor, the surgeon, the person that you're going to see to make sure that they are someone who's skilled and trained in anatomy of the face or the rest of the body where you're having treatment, and that they have qualifications that are consistent with that. And particularly with non-surgical treatments in many parts of the world, there's a lack of regulation in that area, and you don't have to be a doctor, a nurse, or a healthcare professional to provide those services. And of course, if you don't know the underlying anatomy, you don't know what those risks are, but there's a degree of artistry, and so you need to research your surgeon to ensure that you're seeing someone who's going to understand that artistry. This is another image of Nicole Kidman where she's had excellent treatment, where she looks like the best version of herself. So Renee Zellweger, well, she had this procedure around her eyes a few years ago and she just didn't look natural. But there's a degree of artistry with facial treatments and facial surgery. Natural results mean you look the best version of yourself, and scars can be made virtually invisible, they can be hidden creases, and you can largely avoid risks and complications taking meticulous care. And this is a patient of mine who looked tired. She had these kind of loose skin around her eyes. Now afterwards, she's got hidden scars. You would not be able to tell she's had surgery, but she looks the best version of herself. How about unhappy patients? So this is taken from a colleague of mine, Dr. Veal, who is a psychiatrist specializing in this area, and this is a kind of an example of someone who walks around very concerned that everyone who looks at them just sees their nose. And classically, a person may present, and when you ask them a question like, "How many hours do you think about your appearance?" they may say 12 hours a day or 15 hours a day. And so someone who's thinking about their appearance or part of their face for so many hours, well, they may have an underlying psychological issue, such as body dysmorphia. And if you have a diagnosis such as that, well, you may not be aware of it. It's not necessarily something that you would know. And it's important to consider that before having any facial treatment, because you may be unhappy afterwards. And similarly, if you've undergone a recent trauma, a serious life event, and that might be separation or divorce or passing away of a loved one, well, it may not be the best time to have like a facial procedure, because having a facial procedure will not take away that unhappiness or hurt. It's better to wait until that element of the emotion has calmed down. And all of our lives are a bit of a roller coaster. There's certain points where you're on top of the world, and there's certain points that can be much lower. And you don't really want to have a facial procedure or cosmetic surgery when you're in quite an emotional turmoil. You want to wait till things have plateaued out. And I personally have spent a lot of time looking at this, because not just for myself, but I want patients to be really happy after surgery. And I now ask patients to complete a psychological questionnaire where it just looks at elements of this really to test like underlying psychological conditions, and that's purely for patients' own benefit. In terms of sharing information, well, it's really helpful as a patient to share if you've had like a serious life event. And I appreciate, not all of us want to talk about these things, but if you're seeing someone for a consultation, it's really important to be transparent with this kind of information so your doctor, your surgeon can give you the best advice. And of course, realistic expectations. Undergoing a facial or body cosmetic procedure, well, it's going to potentially improve that part of the body. However, it's not going to change your mindset. And if you're unhappy about certain things in your life, well, it's not going to create happiness from that part of your thoughts. And so, if you're a positive person, you have a positive mindset, well, often having cosmetic procedures is successful because it builds on that. But if there's underlying events in your life that are unhappy, you really need to go to that root cause as opposed to just looking for a fix. And we have like image of Katie Price, and Katie Price has had a number of cosmetic procedures over the years, but she's also had a few issues in her life that, well, are not complementary to having good outcomes from cosmetic surgery. So how do we avoid these kind of serious issues? Well, our goal has to be successful procedures with happy outcomes, avoiding these kind of disastrous outcomes. Hospital tourism, well, traveling abroad or overseas for low-cost procedures, the risk is high, and that can ultimately play a very high cost. And unfortunately, we've talked about a few of these cases today, but really have to question whether it's worthwhile traveling for those high risks. The UK, well, it does have higher costs than, say, Eastern Europe and some countries, but it has very tight regulation, which is designed to be safe and help every patient have a successful outcome. My feelings on anesthetic, well, general anesthetic, although very safe in the majority of patients, it does carry a slightly higher risk. And Certainly, for certain procedures and most facial procedures, you can have sedation, which has a degree of safety beyond that. And of course, if you're traveling overseas, you don't know what that regulation is and how you can be protected. In terms of a natural result, well, you need to do some research and find a surgeon or professional who has an artistic flair to give you those best results. Be careful with social media and photographs and some of the promises made on social media. You need to do due diligence, because having a facial or body cosmetic procedure is more than is often advertised on social media. And my advice is, do your research and be careful and follow all of the things that I've mentioned to you today. Well, I do hope this information has been helpful for you. And if you have any further questions or any concerns, please do not hesitate to contact me either through my website or through social media. I hope this has been useful for you, and thank you for watching.